Okay, welcome to Dry Eye Happy Hour. Anybody that's here. If this is your first time today on a happy hour, this is the Dry Eye Foundation's way of just trying to get people more connected for more conversations about dry eye in a more direct way than the groups and the forums online, place where we can find some common ground and talk about our experiences. My goal for these sessions is that people who come or participate come away feeling better understood in their dry eye journey and feeling more optimistic about their solutions. So today our topic is going to be dry eye and our appearance. How dry eye affects our appearance, directly, indirectly, what that means to us and what we're doing about it. So today I actually lost a couple of panelists kind of at the last minute, and so we're shrunk down a little bit. So we're going to be pretty informal. If you are registered, logged in on Zoom, and you're interested in jumping in on this and being on the panel to just help us answer questions and talk through things, please raise your hand and Aiden can turn on your audio and video and you can join us on the panel. Meantime, I just want to mention a couple things about some future sessions coming up in the next month or so. Topics that we've got coming up on future ones. For anyone who's interested in participating in this, if you hear any of these and it's just something that resonates with you, something you have something to say about, please reach out and volunteer. You don't need to know all the answers to be on the panel. It's really just about being willing to share about your experiences and your needs and your questions too. We always have a lot of fun with these. So September 25, that's 2 weeks from today, we're going to be talking about elective vision surgeries and dry eye. That's LASIK and RK and PRK and SMILE and all those things. And I know a lot of people have a lot to say about those. So I already have 2 or 3 people lined up for that. But if there are more that would like to be on that, do reach out. October 9, so about a month away, we're going to be talking about our dry eye fears. What are the things you worry about for the future because of dry eye? Are you worried about things getting worse because you're looking down the pipeline and seeing how this affects you now? What will it be like later? Are you worried about the impact on your job, impact on family, anything in that area? We want to just talk through those. October 23, we're going to be talking about dry eye at work. So how do we cope with the heavy computer use? And but when I say at work, I'm also talking about, of course, work from home now. Things like in the workplace, what reasonable accommodations can we ask for from employers? How do you ask? Lots of things related to work. And then one more thing, I've had a number of people reach out that are interested in having a dry eye happy hour at a time that that's a little more friendly for people in Europe, where it's not the middle of the night. So at scheduling something in the next month or so that would be on one of the Fridays where we're already doing one in the afternoon, but our time, Pacific time, but where we would also do one in the morning. So maybe kind of around dinner time in Europe for more people to tune in. If you're interested in that, please reach out. I'd love to hear from people about what specific times are likely to work for them too. All right, so going back to today, our topic is dry eye and our appearance. There's just a lot in here. I hear from people frequently about this, whether it's chronically red eyes or just very, very tired looking eyes. Or the more kind of indirect impact of not being able to wear eye makeup. A lot of us kind of gave that up a long time ago, but it's a big part of life for many people. Then there's things like wearing these moisture chamber glasses and things that are just not necessarily the fashion statement we want to be making. So we're going to talk through all these things today. So next we're going to go into introductions. And I see we've got Phyllis. And Aiden, is there anybody else
I don't see anyone else, but we have some new people, so I'll extend the invitation again. If you'd like to join the panel with video, go ahead and raise your hand, the little button at the bottom of the screen, and we can add you to the screen.
And you're welcome to join with just audio too.
That's it. Yeah.
All right, so our normal thing for introductions, a lot of you are used to this now, is everyone's sharing what state they're in, what beverage they're drinking, how long they've had dry eye, and why, if you know, where you're at in your dry eye journey, and what drops you used last. I'm just going to go first this time, and I'll make it quick. I'm in Washington State. I'm drinking tea and water. I've had dry eye for 19 years, a little over 19 years now from LASIK. I'm at a pretty stable place with the dryness, give or take some ups and downs, and struggling with some vision issues. And I don't use eye drops a whole lot, but I do douse my lenses sometimes with saline. I've got a vial of sclerofill here I've been dumping over my lenses. We're not in a bad place for fires, but we have a lot of smoke blowing around in our area coming up from Oregon and California. And so my lenses are kind of running a little more ragged than usual. Aiden, how about you go?
Hi there, I'm Aiden, also in Paulsbo right now. I don't have dry eye myself, but I've been working with people for past few years with dry eye. Don't use eye drops too often either. And I think I'm just drinking water today.
All right, Gigi. I know I think we put you through this last time.
Hi, everybody. I'm Gigi. I'm coming from Southern Illinois. I am drinking a Homestead Peach apple cider. I've had dry eye for about 10 years, but more severely this year in March. Why do I have it? I'm still trying to figure out where am I at in my journey right now. I wouldn't say stable. I'm working towards some stability. Last drop I used was actually serum tears that are made out of your own blood that my ophthalmologist has me on. So thank you.
Great, thanks. I think I'm just going to move straight across the screen. The order people are in. Linda, hi, nice to have you.
Hi, I'm Linda, and I have severe dry eye, and I have ptosis on this eye, and so I have a lot of problems with kind of feeling like it's real obvious, and people tell me it's really not so obvious. But I quit wearing makeup probably about a year ago, and so it's kind of difficult, but that's why I always wear glasses. Even if I have my sclera lenses in, I wear glasses. I think it makes me feel more comfortable. And probably the ptosis is not as noticeable with glasses. So am I self-conscious? Yes, I am.
And what state are you in, Linda?
I am in Washington State. I'm in Vancouver.
Vancouver, Washington.
We're having severe clouds and smoke and problems with eyes because it's just, you can't go outside and breathe because the smoke is so thick.
You're a lot closer than we are. You're just right across the river there, right?
Yeah, we're right across the river and the smoke is terrible here. So it's really hard on people with dry eyes. We have to stay inside pretty much. But I've had about 5 eye surgeries, and most of it has been due to Graves' disease. And also, so I've had a lot of muscle surgery, upper and lower as well. Almost all my surgeries were at OHSU, but I did have a couple in California down at UCLA before I moved up here. So it's just been continuing, you know. Either they have to raise a lid or lower a lid, or but because of Graves, there's other issues with lots of scar tissue behind the eye. So between Sjogren's and you know, Graves, it's a lifestyle. you just you know, one day at a time. You learn new things all the time. And I think I even sent in an email to Aiden telling him that I learned here on this forum about using saran wrap on your tranquilize. And oh my gosh, what a lifesaver that was. Whoever told that, I just love it because it keeps my eyes moist all night. And I just put my lubricants in, put my goggles on that have saran, and I'm fine all night. It's great.
Wow. Okay. So you're wrapping saran wrap over the foam on the tranquilized goggle?
Oh, yes.
Right, right, right.
Yeah, just completely wrap it. And it works for me. Might not work for everybody, but it works for me.
I love that that works for you because I know way back in the day, it sounded really unintuitive because the whole point of those pads is to add moisture, right? Put
Right.
plastic wrap over it and it's not adding the moisture. Way back in the day, people kicked that idea around to try to keep the ointment out of the foam,
Right.
keep the
Right,
foam.
it does.
Yeah, but I could see how if you put it over the whole thing too, you're using the goggle basically maybe to hold the lids down, plus
Mhm.
then you've got moisture between the saran wrap and your eyes. Cool. Okay. What are the last eye drops you use, Linda?
I use, oh gosh, they're individual vials. I don't have them with me right this minute. I can find out.
Yeah, no worries. That's just one of our.
Yeah, but they're over the counter. I mean, they're over the counter individual vials that are preservative free. And I can't think of the name.
Okay, no worries. Good stuff. Let's see. I think Phyllis showed up next when you were letting people in, Aiden, huh? Phyllis?
Hi there, I am in San Diego, and since it's only 3 o'clock, I'm still drinking water. I try to hold off on wine until about 4:30 or 5. And I've had dry eye probably since the mid 1970s, and I chalk that up to being an extreme contact lens wearer. I always wore hard lenses, and I lived in some very dry climates. And then I had my newest foray into true dry eye, but it's only on one side, is a result of facial nerve damage. I had a brain tumor removed in 2014. So I have zero tear production on my affected side, and I've had numerous eye surgeries. I also, like Linda, have ptosis. I also have my lower lid sags, so I've had several procedures to pull that up because, if I lose my cornea, I lose my vision. So always, looking for new things. The nearby fire has put a huge amount of smoke and particulate matter into the air. And boy, does my affected eye notice. And so I haven't gotten moisture chamber glasses yet. That's on the list. But I do have these, I guess they're called solar shields. You can actually wear them over regular eyeglasses. And they kind of act like a moisture shield. So whenever I'm outside now with dealing with the fires, and they're not real close, but it is amazing how much particulate matter and smoke there is. I use Celluvisc from the time I wake up in the morning until I just before I go to sleep, and then I use Soothe ointment, and I struggle with my tranquilize. Um, so I'm going to give the saran wrap a try and see, because sometimes it feels like the foam um, actually is kind of counterproductive. So thanks for that tip very much, Linda. I haven't been participating in this forum that long, so I didn't hear the earlier situation. So that's my general story.
Thanks, Phyllis.
Thank you.
Oh, about those, what was it, the solar shields that you mentioned? I remembered those. I've had some of those. I think, in a pinch, there's a lot of glasses that can function more or less as moisture chambers, even depending how they fit your face. I mean, even like fit overs, just the sunglasses that go over glasses, for some people, they can fit closely enough to really make a difference there. Pauline, thanks for joining us. Pauline, are you there? Oh, okay, we will come back to you. How about Judith? Can you unmute yourself? There you go.
Okay, my son is here helping me. We're on Long Island, New York, and it's possible that the dry eye condition that I have is part and parcel with the fact that I have macular degeneration. I read that sometimes it kind of goes hand in hand, but it doesn't matter. I've got it anyway. And mostly I use things that are over the counter. The doctors haven't given me any prescriptions and very little advice. So it's a very uncomfortable thing. I'd like to have better ideas.
Absolutely. Well, hopefully we can help with that today. Are you using drops now?
Only things over the counter.
Do you have a favorite one of those that you use most?
Excuse me?
Do you have a favorite one of the over-the-counter drops you use the most?
I don't have a favorite, no. I've seen, I do have a retinologist, I have an ophthalmologist, whoever I see, I ask them about it. And I haven't come away with any medication or good ideas.
Huh.
It's like they really don't pay a lot of attention to it.
I wonder if you haven't already, if you might need to add a cornea specialist to the mix, because they tend to be the ones that have the most just experience and training really with dry eye. I mean, getting a detailed diagnosis is a key step for a lot of us.
Absolutely. Not something to think about. I never knew about that, but I will look into it.
Neat. All right, over to you, Pauline.
We're still working on trying to get her audio. I'm not sure if it's going to work. Yeah.
I just saw it go unmute, so I thought we were.
Yeah, Pauline, I'm sending you a little message to unmute. I'm not sure if you're seeing it.
Okay.
There we go. We can hear you.
Hi.
Great. Hi, Pauline. How are you?
I'm good. I've had Sjogren's syndrome since 1997 and started having dry eyes in 1991. And for the last 5 years, I've worn sclera lenses. I'm from Wisconsin, and I use Xydra drops twice a day, and then about every half hour I use Bion Tears. And at night I use Soothe ointment and Retain, and I like the idea of using the goggles at night because now that it's getting cooler, it's getting drier and there's less humidity. We've had a very humid summer. So, can you hear me?
The seasonal pieces and the environmental pieces are, I think, really, really big in dry eye. We go through sometimes just good summers where we can slack off of a lot of things we're doing. And then, boy, the cooler weather comes, the heat goes on, and whammo, it can be really hard. So it's smart this time of year to just step up whatever you normally do in harder times of the year and kind of get ahead of it. Of course, right now we've got these extra pieces of lots of smoke out on the West Coast that's kind of wrecking havoc with eyes too. All right, well, thanks everybody for joining. This is great. So we're going to go into our main topic about the ways dry eye affects our appearance and what that means to us and what we do about it. I'd like to just start off by seeing what anyone has to share about specific ways it's affecting you. Is it mostly something about your lids or any eye redness or about not being able to wear eye makeup or about wearing goggles? Anybody like to go first, or should I pick someone at random? Okay, random it is. Gigi?
Sure, I'll go first. So with my with the way that I look, I've noticed the main thing with the dry eyes is towards the end of the day, probably around like 7 or 8 o'clock in the evening, my eyes start just kind of caving in and just look really tired. And I feel tired. And that's one thing that I've noticed. And for the longest time, I thought it was sinus infection. And I was like, well, I've got to, if I just take care of the sinus infection, it'll be gone. Because I actually did have a sinus infection. And so that went away, but that kind of look towards the end of the day just kind of seems to be a consistent thing. And I've stopped wearing makeup. I don't wear it at all anymore. I probably will be able to do a little bit of cover up here and there, but I've noticed even that kind of bothers me. So I've stopped doing that. So of course, with the chamber goggles, I think that I'm still getting used to the way those look. Those are, they're stylish. They make some real stylish ones, but they're still kind of, I'm still getting used to them. In fact, I went to the grocery store just yesterday to try it out, and I kind of looked at me weird, and I was like, is it my goggles? And I'm like, maybe not. I shouldn't just assume. So overall, it's definitely been impacting the way that I feel and look, and just something that I have to work through. And I'm sure all of us have some things that, that we deal with. So that's kind of been my experience with the dry eyes and how I feel. So.
Did you used to wear contacts?
No, I never wore contacts.
The moisture chamber glasses, I look back over the history of that, and for a long time there have been some custom ones available, if you happen to live on Long Island or in Miami. But then, there were like the Panoptics glasses with the black foam around them, have been around for ages. But for glasses like that you could wear to work with moisture chambers, there's just nothing you could just walk into a store and buy. And I remember what a big deal it was, I want to say around 2012, when 7i came out with the very first pair of Siennas. But then it was years and years and years waiting for more styles to come out. So it was really exciting each time a new style came out. And then it was like, oh, but they're still too big for most women. So we're waiting and waiting and waiting for the smaller styles. And it was really great when those latest ones, the Kai and the Marina particularly came out, because all of a sudden it was like there were a lot of people that could get into a pair of moisture chamber glasses where they didn't have to jury rig it and bend it and use a strap and do 15 things to try to make it work for their face. So I'm grateful that we have a lot more tools now than we used to do. Linda, was it you that also mentioned giving up eye makeup recently?
Oh yeah, about a year ago, I just quit. I noticed that like eyeshadow or eyeliner really, really bothered my eyes. And I thought, well, why am I continuing to do this when it is so uncomfortable? Why don't I just forget it? So about a year ago, I quit wearing all eye makeup. Yeah. But I do wear, I do have the 7 Eyes goggles that I wear sometimes at night. I'll take my lenses out like around 9 or 10 at night, and then my eyes immediately just dry up immediately as soon as I take the scleras out. And so I go and get my 7 Eyes goggles, and I put those on to watch television or to read, and that saves me until bedtime. Otherwise, I would just go to bed as soon as my sclera lenses were out, because they dry up so fast. But as far as wearing them to the market or wearing them out to a friend's house, I don't wear my 7 Eyes out. They just look they look weird, they're kind of weird, but they sure work. They really do. They work great. Yeah.
Judith, anything you'd like to share about impact of dry eye on appearance? Is that something you're dealing with at all?
I stopped wearing eye makeup quite a while ago. And I think my eyes look tired. I really think that people notice it. That my eyes don't look like they used to, and I'm blinking a lot. So it's different. It's a different time in my eyes, and I guess I have to just get used to it.
Well, hopefully be able to get some remedies over time that help improve things too. But yeah, I'm thinking about the whole thing of eyes looking tired and how that can affect people. I've heard from people I talk to on the phone sometimes, I'll hear that like all of their coworkers or anybody, friends they run and say, well, are constantly saying, gosh, you look so tired, what's wrong? And they mean well, probably. But when you hear it over and over, that can get to people as well. I'm thinking of some of the folks that I've talked to that deal with chronically red eyes. Talked to a lot of people who struggle with that. That's a big problem for them socially. Is anybody in our group here today dealing with that or had to deal with that in the past where your eyes just seem chronically red?
I do. Part of the problem with the facial nerve damage is that I get what's called scleral hemorrhaging.
Oh gosh.
So, and my unaffected eye is completely normal looking in every respect. And my affected eye doesn't look normal in any respect. And, sometimes, this is all pre-pandemic when I used to see people. People would like look at me and go, what's wrong with your eye? And my eyelids, because of also the facial nerve damage, my eyelids operate independently. So I can I can blink on my left side and my eyelid will close and my right eyelid remains open. So this also throws people off. And I started wearing eye makeup in 1962, and I wore eye makeup probably 6 out of 7 days. And then after the brain surgery in 2014, because I also had a gold weight eyelid implant, I discovered that trying to, and it's sutured in. They open the eyelid, put this 24 karat gold weight in. And what I discovered is trying to remove eye makeup caused me enormous problems. So first I gave up mascara and eyeliner and I just wear a little bit of eyeshadow. But because I have so much facial distortion, it looked weird. So I gave it all up. And several people went, you don't wear eye makeup anymore. And it's like, no, that's just something that went away. And
How do you feel about
I feel like my eyes always look tired. But that's just something I've learned to live with.
Pauline, anything you want to add to this?
I don't know if you can hear me.
Yes.
Okay, good. I haven't used makeup at all for about 5 or 6 years. I quit doing it. And now with the COVID, whenever I do go out, I'm wearing a mask. And because I have severe light sensitivity, I wear sunglasses with a big floppy hat to keep the sun out of my eyes. So You really can't see my face because I'm so covered up. A lot of people have to say, "Is that you under there, Pauline?" But so it's been okay, but it's kind of, there's times that I would like to be able to wear makeup. So it's, my eyes aren't red. They're very tired. And at night when I take my sclera lens out, I usually put ointment in right away because my eyes are so sore and dry. So then I walk around with goopy eyes trying to do things in the evening, and which usually consists of listening to books on tape or listening to radio programs or podcasts. But so that's kind of where I'm at. And unfortunately, I have to cut out of the group, but it's been very interesting, and I hope that I can join another time. But the timing is ending for me. But thank you very much for
Oh, thank you for joining in, Pauline. Appreciate
thank you
it.
for sharing, everybody for sharing too. It's encouraging. At least it's good to know I'm not alone. So it always helps. So thank you.
All right. Thanks, Pauline. Hope to see you another time.
Thank you.
Rebecca, when
Yeah.
you asked me what products I was using, I had to go look. And I use Refresh Optive during the day. I use these are individual vials, and I get these at the grocery store. And then at night, or even in the morning, I fill my sclera lenses with Refresh Celluvisc, and I use it maybe half and half, half Celluvisc and half just saline. And then at night, before I put on my moisture chamber glasses, I use something called LubraFresh. It's called LubraFresh PM. And I get this online through Amazon. And this is great. This is great stuff. It's very thick. And so I use that at night. So there's my products.
I have to look that up again. I was thinking that was one of the ones caught up in those recalls last year.
I think it was called Lubra.
Oh, Pure Lube.
It was called Pure Lube, and now it's under a new name and a new formula. So it's called LubraFresh PM. But it's the least expensive way to buy it is online. Yeah.
Yep.
So
Many things. On the just other ways dry eye can affect people in terms of appearance, some of the things that I'm hearing from people on the phone are, like, I spoke with somebody recently where their eyes were just constantly watering. And that's one of those things where it seems counterintuitive. How can your eyes water when your eyes are dry? People have kind of been around the block with dry eye for a while know that you can have dry eye and have a lot of eye irritation, which is triggering reflex tearing, causing your eyes to water a lot. So talking with somebody where they had to deal with people constantly asking them, what's wrong? Thinking that they were crying because their eyes were running all the time. Just curious if any of you have ever dealt with runny eyes, if that's been a problem for you.
yes, I have had that. And that's been about maybe six years ago. I went to the optometrist and told him my eyes were watering. And that's when they closed the drains, a permanent closure. I don't know what that's called.
Punctal cautery?
That's it. That's what I had done in the ones that are in the center of your eye, and they cauterized those, and it seemed to help a lot with the dry eye, with the watering.
Mm-hmm. It's funny that it's just like I said, it sounds counterintuitive to a lot of people that dryness would cause watering, but it still can for lots. Mm-hmm. Any other ways in which dry eye is affecting appearance for anyone in the group? Or we just kind of covered that. How about at work? Anybody here working and finding dry eye affects them just in dealing with people at work? Not really. Have we've got a few retirees here, I'm thinking.
I'm retired.
Okay. What about socially? Some things have already come up. Let's just see what anybody has to add. Linda, sounded like you.
Oh, socially, it's just I think I'm kind of self-conscious about my eyes, but overall, my family and my friends have been supportive and said, you know, whatever works for you, you do that. You know, make yourself comfortable. Don't worry about appearances. Just be comfortable. So that's kind of what, you know, I do.
This is terrific to have that support.
Can I bump in?
Yes, please.
I have so much facial distortion. I kind of look like a post-stroke patient that a lot of times people don't notice my eye issues because my facial distortion is rather pronounced. I've had several surgeries and looking at a couple more trying to mitigate some of the damage. So, I mean, you know, I see all the issues with my eye. And so it's just, you know, kind of, yeah, it's for a long time after the damage happened, I was very, very embarrassed and very self-conscious. And I didn't do very much socially for several years. I kind of wound up being medically retired after 2014. And, you know, I have some private clients that don't have a problem with it, but trying to get another job. I was an accounting professional for a number of decades, and even trying to get a back office position just didn't happen. You know, it's sort of like I look disabled, but mentally I'm not disabled. So that's kind of where it's at for me.
Mm-hmm. You know, when you're talking about kind of how your eye appears, maybe just kind of blending into other issues, I was thinking a little bit about some of the posts that I see sometimes on the Facebook groups where somebody's just very painfully conscious of something wrong with their eyes and feeling really embarrassed about it. And they post a picture. And it's always so interesting to see the responses, because a lot of us will be like, wow, you look great. And you've got beautiful eyes, by the way. And then others will be, oh, I know exactly what you mean. Mine looks exactly like that. There's so much that we're personally very, very conscious of that isn't necessarily obvious to others. I think, Linda, you were talking about that too a little bit with the ptosis. Is that right?
Yeah, I've had three surgeries for the ptosis. And the doctors up at OHSU are very, very good ocular surgeons. But they said to raise that eyelid to where it would match the other one would be would not work for me because it would make the eye more dry. They said with Graves' disease and the eyeball pushes forward, then if you expose it more, then you're going to cause more damage to the surface of the eye. So after the third try, they said, no, we're not going to do it to you because you'll be back in here asking us to lower it because of the pain. So I think I'm going to stay with what I've got.
You got that, yeah, just hard cards there with the Sjogren's and Graves together, but I think you're wise to stay away from that. I think a lot of these situations with a non-closing lid or just something not functioning about the blink, they can just get more painful than anyone would believe. I had a
Yeah.
long talk yesterday with someone over Zoom about just Bell's palsy and how much that was affecting their eyes. And there's whole groups out there, just like we have our dry eye groups. There's groups out there for facial paralysis, and lots of people that struggle with the pain from lids not closing too. So one thing that when I've been talking about red eyes, it's because when I started this thing about talking about dry eye and the appearance, I thought that was one of the first things that would come up, because I hear about it so much on the phone, and that's not so much part of our group's experience, except for with the hemorrhaging. I think Phyllis, you brought up, but I do just want to mention a little bit more about it, just because I know we have a lot of people that are interested in that. There are a lot of people that get chronically red eyes, whether it's dry eye mixed with ocular allergy, sometimes reactions to products they're using for the dry eye. And it can be a really socially disabling thing. I hear from young people about this, especially with, imagine you've just come out of college and you're applying for jobs and your eyes look bloodshot all the time. What's a potential employer going to think? I talk to students whose professors treat them differently because they're making assumptions about their lifestyle because of the redness in their eyes. And that creates some traps too then, because a lot of people then naturally gravitate towards the redness reliever eye drops, most of which are pretty damaging for dry eye. They get you coming and going. You get the redness rebound effect if you're using them regularly. You get the toxic preservative, BAK, in there as well. And even the new eye whitening, I guess I could call it, drop Lumify, that many people are very excited about, that still has the really toxic preservative in there that's known to cause or exacerbate dry eye in like 7 different ways. So sometimes it's just hard to get solutions for that other than continuing to treat the dryness and any other conditions there to get at the underlying stuff to relieve it. Phyllis, am I remembering right? You were the one with some hemorrhaging going on there?
Oh, yeah, I have, I call it scleral hemorrhaging. One of my eye care people, I have a whole raft. I have a neuro ophthalmologist. I have an oculoplastic surgeon, and she calls it subconjunctival hemorrhage. And that basically just incredibly one bloodshot eye. And it's very painful. And I figured out a few things that make it worse. So I try to avoid doing those things. And for me, when I lean forward, like if I'm picking up something off the floor or cleaning, I will all of a sudden notice extreme scleral hemorrhaging. And then also my eyeball itself starts to be painful. And the only thing that works is to lay flat on my back and close my eyes for 10 or 15 minutes, and the pain will go away, but I still have incredibly one bloodshot eye.
The subconjunctival hemorrhages, my understanding is, for the most part, they're harmless, but boy, do they look scary. I had one I know that, but I had one for the first time recently, and it was pretty startling. All of a sudden, this great big red splotch on your eye that just looks like something's bursting, which, a blood vessel it is. Like I said, it's not necessarily doing any harm, but they're disturbing to look at for sure.
Yeah, mine usually is in the same place. It's the lower outside quadrant is typically where my scleral hemorrhaging happens. And the other day, when the fires were really intense and smoke was everywhere and particulate matter, my entire sclera corner to corner, top to bottom, bright red.
Yikes.
Yeah.
Uh,
And, there's no amount of Celluvis that will help that. So I just, I put ice on for a while. Sometimes that'll help. But I just tried to stay inside and keep the windows closed.
mhm. So it looks like we had somebody new join and I didn't see him in time and now we've lost him, but I hope Marla can come back on video and we can have her join in. You know, going back to all of the glasses and things and appearance in general, it just seems to me that the year of coronavirus is like the one time when we get a little bit more of a free pass because everyone's face looks different most of the time now. Everywhere we go, everybody's in a mask or a lot of people have eye shields and things. So in a sense, we can just get away with more or we have a little bit more to hide behind as well. Let's see. Judith, you are the kind of newest to this, it sounds like, and I'd love to just get into, I think we're maybe running out of things on the kind of appearance side of it, but I'd love to just hear a little bit more what you're going through and see if any of us have any tips for you.
I heard somebody mention that they're very sun sensitive. I'm very, very sun sensitive. I don't know if this is part of it, but there are times I wear sunglasses in the house because I can't take the light. And I don't know if anybody else finds that.
Anybody else in our group? Go ahead, Linda. Sorry.
I definitely am sun sensitive. I don't wear them in the house, but I can't go outside for any reason without dark glasses. And I wear the wraparound sunglasses.
Yeah.
I wear those at the market and I wear them driving, but I don't wear them in the house. But yeah, I'm light sensitive. Yeah. And I think that's probably due to my surgeries. That's what I'm thinking.
I don't know if it's the dry eye or if it's the macular degeneration, but both of them, one or both of them has made me very, very light sensitive. I can't take bright lights in my house. I'm constantly turning it down a bit. Mm-hmm. And I've often wondered if I get shots every month. And I wondered if a lot of the medications that they use when I get the shots had anything to do with getting the dry eye. If anybody has anything like that.
It's possible. There are an awful lot of drugs out there that have dry eye as a side effect. Doesn't mean that everyone who takes the drug gets that side effect, but you know, for a lot of people or some people, it can at least sometimes make it worse. That would be another reason I'm thinking in favor of seeing like a cornea specialist who can kind of go through that whole profile.
I've already written it.
Right. Just to see, sometimes if there's a drug causing too much dry eye as a side effect, sometimes there's an alternative that has a better side effect profile, or maybe it's sometimes just about increasing the dry eye treatments. But it seems to me like if dry eye is affecting you to that point, if the light sensitivity is from dry eye, which it often is, light sensitivity is a common symptom of dry eye. It seems like they could be doing more with diagnosis and getting you on some treatment that really improves the tear film to the point where you're more comfortable and seeing more comfortably. I've known lots and lots of people over the years who had gotten to the point where everything was simply too bright and it's, you know, indoors with the lights dimmed and the drapes closed and still in sunglasses. It's like, when you describe it, sometimes it doesn't sound like light sensitivity could be that big of a deal, but it's really huge. And technically it's considered a form of eye pain too. So it really does affect people.
Absolutely.
A lot of us wear those protective glasses with the foam lining. So when we talk about wraparound, sometimes we're talking about the ones that have like not just the sunglass frame, but it's got a foam insert in it. I wear glasses like that when I drive so that I can have the heat or the air conditioning on when I drive, and then anytime outdoors in the wind. But what I like about the foam lining is that in addition to keeping wind out, it keeps light out from around the edges of the sunglasses. So like when I'm driving, I find light coming in around the periphery is even more painful than, you know, what's straight ahead of me. So just getting my eyes completely closed in really helps. I have to be careful with them to make sure they're not blocking my side vision too much. So I get ones with a really deep kind of sports wrap on them.
I'm gonna write that down too. Take note.
Yeah. Linda, you held up your glasses, and I'm not sure everyone saw because you weren't speaking. But
Well, I thought maybe I would show Judith what they look like.
Oh, great.
Yeah, mine are the 7 eyes. And if you put them on, and then you can tighten the strap in the back. And they block out all light and all air from around the outside. And they look like motorcycle glasses, and I think they originally were motorcycle glasses, but I wear them at night just to watch TV or to read. Now mine are clear, but you can get them in darker shades. Yeah, but they're a lifesaver. I couldn't.
Just noticing you had clear lenses in those. That's like exactly what I would
Okay.
suggest to person like.
Yeah. Mhm.
A
Great.
cheap version of what Linda's wearing would be onion goggles. So onion goggles are only available with clear lenses, but they have that deep foam lining. It's not removable, but it goes right to the skin. So onion goggles would be 20 or 25 bucks compared with 100 or so. So they're a really handy tool to just get more comfortable indoors, especially. But yeah,
None of it is covered by Medicare.
Nope. Nope. That's why I always look for what are the cheap knockoffs? Yeah, onion goggles actually are a cheap knockoff of one of the 7-eye frames that had been on the market for a long time.
Yeah, I did try onion glasses at first, and they were very helpful, but I just wanted more coverage. So I ordered these.
Yeah, the thing with the 7-eyes is they have a ton of different frame styles. So if one doesn't fit just right, you can try another one. I mean, it's a little harder these days. We can't necessarily go to the stores to try them on, but even just online, sending them back, getting trial sets and things.
They will let you send them back and send you a different pair. If they don't fit your face right, they'll let you send them back. Yeah.
I'm taking
Copious notes.
been very informative. I've got notes.
Yeah.
On the 7-eye site, they usually advertise a thing for like a trial set where you can pick 3 frames. Either you can call them and ask for advice, or just online you can select 3 frames, and for a pretty low cost, they'll send them all to you to try on, and you just send back anything that's not working or fitting. So they're very dry eye friendly type of company.
Are there any special sites you go to for them?
So there's 7eye.com. It's the number 7 and then EYE. .com. Yeah, I mean, you can buy them at other places too, but I mean, I would encourage you to just give the company a call. They're a small outfit down in Southern California. I know the owner there is really nice, and is one of the few companies that's really trying to develop more things for people like us, which is great.
Good to know.
All right. How about anybody here wanting to share any more of their just favorite tips for how they're coping day to day? Gigi, can I call on you first again?
Sure. How am I coping day to day? Well, so I joined this group a couple weeks ago, so it really helps me get some tips from you guys. So that's what I've been doing. And then I'll go on the Dry Eye Foundation website and I'll read different people's stories. I've talked to Rebecca a few times. That's really helped me kind of when I'm at a low point or I feel down. And honestly, I just like call my friends. I don't even bother like looking at my phone, texting people. I just will call my friends, and I'm in the healthcare field, so a lot of them understand that I'm in pain and that it's a real thing. But I still struggle. I still struggle daily. I'll look at people and I'll look deep into their eyes and I'll just be like, wow, those eyes look so lubricated and nice and refreshed. And I'll just stare at other people. I'm like, wow, I wish I had those eyes. I don't know. It's crazy. So I'm still getting on the bandwagon of just acceptance. I struggle with it. So I'm trying to think of what else helps me get by. I do way too much research. That doesn't help. Sometimes it helps. If it helps you, then do it. If it doesn't, don't do it. It doesn't help me. But I think also just having follow-ups with a good doctor helps. Just look forward to something. I mean, I was fortunate enough to find a good cornea specialist in the Chicagoland area. So I have a follow-up next week to see if there's anything else out there treatment-wise. So that helps me kind of just look forward to things. And yeah, just call my mom, cry to her. Crying sometimes helps because even though they're emotional tears, they will lubricate the eyes. So, you know, I think just being compassionate and understanding that this is not anybody's fault is important. So I think
When you
that's
talked about doing lots of research and it not helping, can you elaborate on that?
Oh yeah. So I'm a physician assistant. I'm in the healthcare field. So I'll go out there and I'll look at all the research and the trials and the studies, and I'll research this from top to bottom. And sometimes it can be helpful where I'm like almost there. I found the cure to dry eye, and then I'm like, oh, my eyes are tired and dry because I haven't blinked in about 10 minutes because I'm trying to find a cure. So that's been my experience. But I mean, I've looked, and there's stuff that you know that people find relief. But mostly, what I'm looking for when I'm on there is kind of hope, you know. So, and you find that you can find hope better than than you can find other things. So that's been my experience so far. That's why I'm here. So.
And hope is everything. And I think it comes in many guises for sure. It can come from talking to people who have been through these places and come out the other side and doing okay. It can come from the research too sometimes. I mean, I think with looking at research, one of the things to keep in mind, because it can get very confusing, you'll see 10 million studies and some of them seem to contradict each other, but just knowing that much investment is going into dry eye, it means there's an awful lot of people out there working on this. I always feel that that's hopeful. I mean, when I hear from people who are thinking, oh God, what's this going to be like in another 10 years or 20 years? It's just going to get harder. Not really, because there's just more and more that's being discovered. I think of how little there was when I first started up like the dry eye zone. There was just nothing out there. There was artificial tears and plugs, and Restasis had just been out for a couple of years. And that was it. And it's a whole different world now. There's masses of stuff. Both on the prescription side and devices, and meibomian gland disease, which nobody ever even knew what that was back in the day, but now there's so much that's known and being studied, and even eye pain is beginning to be understood and studied better these days. I think connecting to people is really important for hope. Anybody else? Top tips? Phyllis, you got any bright advice?
Gosh, I find for me, getting good quality sleep is incredibly important for so many reasons. Because as a result of the facial nerve damage, I also have a lot of balance and vestibular issues, which are made more intense the days that I don't get a good night's sleep. So that's something I really have been trying to improve my what's called sleep hygiene. And one of the things I'm discovering is that I really shouldn't be using my laptop after 8 o'clock at night. And I'm getting ready to buy some blue blocker lenses. And I was thinking, wow, I wonder if I could get blue blockers in the moisture chamber situation, and then I would only need one pair because um, my dry eye, as I said, I had for decades regarding contact lenses and living in dry climates. And then after I had my cataract surgeries, I also had LASIK touch up. And that really triggered um, dry eye in both eyes. And now, post surgery, with the one affected eye, I find that I no longer need any eye drops in my non affected eye, which is kind of interesting that my body seems to have adapted. Um, so, just try to be kind to yourself. That's my biggest tip, especially in the new COVID-19 era that we are all living in. We have to be kinder to ourselves and not have so many expectations. Um, and like several other people said, sunglasses, a mask, and I usually wear a big floppy hat because I've been light sensitive for decades. And so, I need super dark glasses. And if I go before COVID-19, if I would go to a friend's house and they'd have too much light on, sometimes I'd have to put my sunglasses on in the house because my eyes would not be happy, And I kind of have given up listening to weird comments from people. I don't think people mean to be cruel. And I've just learned to just let them go. That's their opinion, that's their thought. Okay, fine. I don't have to buy in. So don't buy in and be kind to yourself.
Great advice, Phyllis. I wanted to comment on the sleep thing. I mean, you've obviously got some complex issues, sounds like all of which benefit from paying attention to good sleep, but specifically for dry eye, that's a well-documented thing scientifically. How much sleep you get plays into how your tear film is doing and how your eyes are going to feel. I see that a lot in myself. I don't always deal with it appropriately, but I definitely know of it. I was just reminded of it in a medical conference just the other day online, the extent to which getting more than 6 hours of sleep, say, per night is an important factor in keeping your eyes comfortable and hydrated. Also, I just wanted to comment on what you said about LASIK after cataract, because I think that this is a hugely overlooked area. Cataract surgery itself can cause or increase dry eye. I think a lot of people know that at this point. But for a lot of people, after cataract surgery, they're also getting a touch-up of some kind, whether it's kind of RK style relaxing incisions or whatever they call them, or LASIK or something similar, just to correct some like residual astigmatism. And that can be a big factor in increasing dryness. So, if you're approaching cataract surgery, definitely worth talking through all of the pieces, not just the cataract piece, with the doctor as regards how they're going to affect dryness potentially. That's another area where I'm thankful for the progress we've seen. Because I'll tell you, 15 years ago, there was not a lot of conversation going on about dry eye and cataract. And I commonly heard from people that their doctors told them, oh no, that won't happen. Oh no, that can't happen. But now what we're hearing from people is, my doctor wants to pre-treat my dry eye before cataract surgery. So
Oh, interesting, interesting. Because I had my cataract surgery in 2006.
Mhm.
Um, and, I had, as I said, I had been dealing with dry eye being a contact lens wearer for 40 plus years. And so I thought, wow, no more contact lenses, maybe no dry eye. And I kind of threw that out to the um, eye surgeon, and he said, well, sometimes people have some dry eye just with the cataract surgery. And I have implanted lenses. Um, and then I had pretty serious astigmatism. And so I had LASIK to correct that. And then I noticed, boy, the dry eye was actually even more severe than when I wore contact lenses. So, started, and by that time, the variety of products was getting large and more preservative free products.
Mhm.
So, yeah, and I have friends who are totally terrified of getting cataract lens surgery. And now it's gotten people I know who are having it done, they're actually doing both eyes at the same procedure. Which back in the day when I asked, could I do both at the same time, my eye surgeon, acted like I was asking if I would like to have, that I'd like to have a limb removed. And oh no, we don't ever do that. Okay, fine. So, you know, um,
Things
but
change.
for me, getting the cataracts gone, because I had early cataracts and I struggled for 10 years from the time I was 40 until 50. And then finally, one day, I just said, I can't deal with this anymore. And so I was very happy with the outcome. And I figured, okay, if I have to deal with dry eye, very small negative, considering that first time in many decades, I had great vision and didn't have to put in contact lenses.
Mhm.
But yeah, it's definitely a topic to bring up. And, I believed in being an informed consumer. And
Absolutely.
nowadays, that's what I feel like we are. We are consumers of disease care. I don't want to call it health care anymore because nobody talks about health. It's all about disease. So yeah, I'm consumer and I do a ton of research. And I go in to every medical appointment I have with a ginormous list of questions. And some of my practitioners are okay with it and they've gotten used to it, and others roll their eyeballs. I've had a couple ask me, where did I go to medical school, little lady? And I get the condescending, don't worry about it, just do what I tell you. That's the last time I see that practitioner.
Yep. In this day and age, I think, you know, it's just not appropriate for any doctor to be taking the approach of I'm God and just do what I tell you. It's a collaborative relationship, and there's different levels of collaboration for sure. But they need to be able to listen to questions we have and to information we bring, because we're all consuming masses of information out there, and we need to be able to rely on our doctors to help us sort that out, the wheat from the chaff, as it were, and find the information that's both most accurate and most relevant for our personal needs, for sure. One last comment on something you mentioned, Phyllis, about you were looking into blue blockers and whether you can get those in moisture chambers. Yes, you absolutely can. I believe the 7 Eye Company has a blue blocker lens. It's like Bluebird or something like that that they offer for the 7i and the Sienna glasses. And then any of those frames, you know, when people need prescription lenses anyway, they often take them to a local optician, and you can have that aspect added at that point. Linda, any
Yeah, I no longer need prescription lenses,
right.
but I'm definitely looking into the blue blockers so that maybe I can use my computer after 8 o'clock at night.
Well,
Oh, yeah. The only thing I was going to mention about my 7i glasses is that mine I ordered with a bifocal. So you could order them with a bifocal, so you can still stay up at night reading with your goggles on. But if you can't really, if your eyes are bothering you so much that you can't read or keep them open, you can also order audiobooks, or you can go on a podcast. And I do that often, just so I don't have to use my eyes.
Okay. I don't have to use, my implanted lenses are basically a multifocal. So I no longer need any kind of reading glasses, distance glasses, no glasses.
Right.
They fixed my vision.
Yeah, that's
And
great.
so the only thing I struggle with is in my affected eye when I put in the Soothe ointment at night, vision is basically gone, so fuzzy. So I just basically cover my eye with my right palm and read because because I have hearing loss, I have no hearing on one side as a result of the brain tumor. So audio books for me are not as enjoyable as reading.
Mm-hmm.
And luckily my good eye is great. So it can stay up all night and read if I want to.
That's nice.
Sometimes I do, and then I pay the price the next morning with my affected eye being, whoa, very bloodshot, at 6 a.m.
Linda, I appreciate your mentioning the audiobooks. This is something I've been hearing from more and more of my dry eye friends, and kind of footnoting, yeah, great for everyone else except not necessarily for me, but it's like enough times and it's finally penetrating my skull that this is something I really probably need to do. I love to read, and I can't read in the evenings. My vision's at a point where I have to have very bright light to read, but I can't tolerate the light. So reading's just kind of gone. I've got like a list of books from my kiddo that I'm supposed to be reading so we can talk about, and I haven't. And I think it's probably the time I need to start embracing that. It is a really good tip.
You can order online. Yeah, you can order audiobooks online from Amazon, or you can order them from your library and pay nothing.
Right. Also, if you have visual impairment, I forget what the name of the service is, but there's great service that you can order tons of things.
Mm-hmm.
I'm looking around to see if I still have an old catalog, but I don't see one. So I'll try to locate one and I'll email you that information. It actually comes, if you sign up for this, you get a free device and you get these little cassettes that fit in the device that are audio.
Oh, it might be the Wycliffe Foundation.
No, that's not the name of the one that I'm familiar with.
Oh, okay. I'm going to have to bug out here. I have another meeting.
Thank you so much for joining, Linda. I appreciate everything you shared. This is really good. I'm going to go ahead and just wrap up here for our whole session. I just appreciate everybody that jumped in spontaneously and were part of this today. Really Do appreciate that, and hope there are others out there listening that are interested in being part of a conversation on another topic. I'm going to keep posting upcoming topics at dryafoundation.org. For those of you that are on the mailing list, you'll be seeing those come out in emails every now and then as well. And if there's any topic you're just particularly keen to see us cover in one of these, you can always reach out and ask. We just schedule maybe a month or two out, and we're just continually adding new topics. So thank you, everybody, and love to keep in touch with all of you. I know most of you in some degree. And Judith, do keep in touch. Don't hesitate to call or email the foundation too if you got any questions or anything we can help with. Too. All right. Thanks,
Good
everybody,
meeting.
for joining today.
Thank you.
Have a good
Bye.
weekend.
Bye.